Artificial intelligence is set to totally change the game in medicine. I mean, from diagnosing diseases with almost superhuman accuracy to personalizing treatments right down to your DNA. The promise, the hype, it's absolutely enormous. It really feels like we're standing on the edge of a massive revolution in how we do healthcare.
But with all this incredible potential, you got to ask the big question, right? Is AI really the new doctor in the house? Is it actually being used today, out there on the front lines? Well, that's exactly what we're going to dig into.
So first, let's just take a quick look at why everyone is so incredibly excited. The potential upsides of AI, they're not just small improvements. We're talking about a complete revolution that could touch pretty much every single part of medicine.
I mean, we're talking about AI that can look at an MRI or a CT scan and spot things that even a highly trained human eye might miss. It could help create treatments designed specifically for you, not just for your general condition. And think about this. It could automate the mountains of paperwork and soul-crushing admin tasks that lead to so much burnout, freeing up doctors and nurses to, actually care for patients. And that's not even mentioning how it's speeding up drug research or helping surgeons in the operating room. The vision here is a healthcare system that's just smarter, faster, and way more personal.
Okay, so that's the dream, right? That's the promise. But what's the reality for the actual healthcare workers on the ground right now? Well, the data from some recent studies paints a very, very different picture. Let's just start with this number, because it's a big one. A major study in 2024 looked at over 900 healthcare workers and found that nearly 60%, that's 6 out of every 10, said they had absolutely zero prior experience with artificial intelligence. None. Zilch. And if you thought that was surprising, get this. The same study found that more than 80% of these professionals have never used a single AI application in their day-to-day work with patients. Just let that sink in. This incredible technology exists, but for the most part, it's not even reaching the bedside.
Which brings us to this perfect analogy. You've got this amazing, powerful technology on one side, and on the other, you have the people on the front lines who can't use it. It's like a high-tech sports car that's just sitting in the garage. So the huge question is, why? Why is this game-changing tool just sitting on the sidelines? Well, to figure that out, we really need to get inside the heads of these healthcare workers. To understand this gap, we have to understand their perspective. And it turns out it's this fascinating mix of real hope and some very real hesitation.
First things first, let's get one thing straight. This is not an anti-technology problem. As you can clearly see here, the overwhelming majority of healthcare workers say they're somewhat or even very familiar with computers. These are tech-savvy people. They use complex digital systems every single day. So a general fear of tech? Nope, that's not the issue.
But here's where it gets really, really interesting. This is where the knowledge gap starts to show. When you ask them a simple question like, what is ChatGPT? Well, only about half could correctly identify it as a type of AI. A huge chunk, over 40%, were either unsure or just plain wrong. And this points to something critical. There's a huge difference between being comfortable with computers and actually understanding what AI is and what it can do.
But look, this hesitation isn't just about a knowledge gap. It's also rooted in some very real, very valid concerns about the potential downsides of bringing AI into a field where the stakes are literally life and death.
You see, healthcare professionals are looking at two sides of the AI coin. On the one hand, they are genuinely excited about automating tasks, making better decisions, and getting better outcomes for their patients. But on the other hand, they have some serious fears. They worry about the dehumanization of medicine, losing that critical human touch. They're deeply concerned about patient data privacy, about biased algorithms making catastrophic errors, and about their own skills becoming obsolete. And yeah, in the back of their minds, there's that quiet fear of their jobs being at risk. So, all of this, the low usage, the knowledge gaps, the legitimate fears, it could paint a pretty bleak picture. But the research uncovered something else, something that is a crucial turning point and shows us the real path forward.
This number changes everything. A staggering 85.4% of healthcare workers said they want more training and education on AI. Think about that. This isn't resistance, it's a request. They are not pushing back on the technology. They are asking, practically begging, to be empowered with the knowledge to use it safely and effectively. And that overwhelming desire to learn gives us a crystal clear roadmap. The research is basically telling us that bridging the gap between AI's potential and its actual use, it's not a technology problem, it's a people problem. And here's how we can solve it.
The path forward really rests on three main pillars. First, targeted education. We need training that builds real AI literacy and confidence, going way beyond basic computer skills.
Second, we need clear policies and ethical rules so that everyone knows the guardrails for using these powerful tools. And third, and this one is huge, we have to build trust through transparency. AI systems can't be mysterious black boxes, and patient data has to be protected, period.
So, at the end of the day, we need to reframe this entire conversation. The arrival of AI in medicine isn't an if, it's a when. And the when is now. The real question we need to ask ourselves is this: how do we shift our focus from just building the tech to empowering the people who will actually use it? Because they aren't the barrier to this revolution. They are the key to making it a reality for all of us.